Hey guys, welcome back to another video in our pediatric safety series. I'm Amber and today we're going to be talking about infectious and communicable diseases in children. So first of all, what is an infectious disease? An infectious disease is caused by a microorganism that gets into our body and causes an immune response. Examples of a microorganism, which are teeny tiny little little beings, are bacteria, viruses, fungi, and parasites. And they can get into our body by just contact with another person, just our general environment with like touching things, door handles, stuff like that, animal and just contact with animals or animal bites, and then also insect and parasite bites. So one of the things in children, the immune response that they tend to have would usually be like a very high fever, muscle aches, fatigue, diarrhea sometimes, and then also anorexia, which is the loss of appetite. So today in this video, we're going to be talking about 3 different types of infectious diseases that children can be exposed to. And the first one is pertussis. So pertussis generally is called whooping cough, and it is a respiratory tract infection. And so with pertussis, the most common cause would be a cough that sounds like a whoop. And so it sounds kind of silly, but it's a very distinctive, like once you hear a child that has whooping cough, you will never forget it. And a couple other types of signs and symptoms with pertussis would be rhinitis, which is runny nose, nasal congestion, and sneezing. And then a child can also have a high fever with the pertussis. The biggest thing with pertussis is that with children it can be, or with infants, it can be fatal. So with them, they get so exhausted with how much they're trying to cough and so fatigued that it can cause periods of apnea. And apnea is when they stop breathing for short periods of time. The next type of disease that we're going to talk about is varicella zoster, which is commonly known as chickenpox. And this is a viral infection. You mostly see it on a child's skin, so it's going to be a skin infection, and it looks like a blister-like rash. It starts out on their face and their trunk, and then it can be extended to their arms and their legs once it's like started to be more exposed. The biggest thing with chickenpox is that it can last anywhere from 1 to 2 weeks, and they would be out of school at that point. And chickenpox is also extremely contagious before the rash even starts. And they show different signs and symptoms, but usually it just looks like a general cold. And then afterwards you're like, hey, my kid now has a rash, and by then you could have already been infected by it too. So yeah, kids with chickenpox are going to want to be out of school because you're going to want them to be out of contact with other children, and just not around other people so they don't spread that infection. The last one we're going to talk about today is measles, and measles is a viral infection. It looks like a fever in kids. They can have muscle aches, they can have a sore throat, and then they can also have red, blotchy skin, which is what measles causes. It's not the same as chickenpox. It looks a little different, but it's more of like a flat skin infection. And with them, the most important thing is that they're again going to have to be out of school for a few weeks until that disease goes away. And so yeah, they're going to have to be out of school, out of contact from other people, other children. So that's the biggest thing with them, because we don't want them to miss any school. So next we're going to talk about different ways of transmitting diseases. The first one is droplet precautions. So droplet is any type of respiratory droplet, which can either be from coughing or sneezing. It can be in saliva, but any type of like mucus droplet that forms in like the lungs or the mouth or anything like that. An example of droplet infectious disease would be pertussis, which is that whooping cough that we talked about with little children. So we definitely want to not cough around them so we don't spread that droplet to them. The next type of transmission is airborne. With airborne, it's mostly just like teeny tiny, super microscopic particles that are within the air around us. We breathe them in, and it affects our body, gets into our blood and our lungs, and just infects our body that way. And an example of an airborne virus would be the varicella zoster, which is that chicken pox. Chicken pox can also be contact as well. Once the blisters form, if you come in contact with the blisters, then you could spread the disease that way. And our last transmission is contact. So with contact, it's like what I explained earlier. You come in contact skin to skin with another person, and it just basically, it's from one person's skin to another. The bacteria gets on that person's skin and infects you that way. One of the diseases we talked about today, the measles, can be contact when the child forms that blotchy red rash. And then measles can also be droplet as well when they have like a sore throat and things like that. So next we're going to talk about prevention. And the first thing on our list is hand hygiene. So hand hygiene is the #1 way to prevent all infectious diseases, and that's with children, adults, and then also elderly children. We can either do that as healthcare professionals and then also be teaching as well correct hand hygiene. So that is washing your hands vigorously for at least 30 seconds. You can sing happy birthday while you're singing to try to like pass the time or to get to you the 30 seconds. And that is scrubbing in between your fingers, scrubbing underneath your nails, and sometimes even your wrist, and you can go up from there, but mostly just your hands. And then rinsing that off really well. The next type of prevention that we can do for our kids are using the correct PPE. So PPE stands for personal protective equipment, and there's a couple different types of personal protective equipment. You can either use a mask, you can use a gown, and then also like gloves. And so depending on the type of transmission that you have with your disease that you have, you're going to use a different type of PPE. The first kind with droplet, you're going to be using a mask mostly, so you're not transmitting droplet, and then you're also not getting in the droplets that the people you're around, the children you're around are using, and you're going to have gloves on. With airborne, you're going to have to get an N95 mask. With this type of mask, most of the time your employer is going to provide that because you have to be fitted for an N95 mask, and there's different sizes. You want to make sure that you have a properly fitting N95 mask, because if it does not fit properly, all of the airborne bacteria or viruses or whatever can get up underneath your mask, and then you're not really using it really well for prevention. So you want to make sure you're getting fitted for your N95 mask by your employer. And then the last type of PPE would be contact. So you're going to use a gown with contact, and then you're also going to be gloved. And then back to what I said earlier, how some of the other infectious diseases have multiple ways of transmission. Sometimes you're going to be using a mask like with your gown and gloves to protect against that whole spectrum of what that disease has. The next point of prevention would be disposing of needles properly into the correct bins, and then getting rid of biohazard or hazardous waste in biohazard bags. So that would be in the red or the black bags, depending on if it's like blood or chemicals or something like that, so that the children don't come in contact with it. Another point is teaching people cough etiquette. So this is coughing in your elbow, or definitely coughing away from someone else, so that they don't spread that type of droplet to another person. Another thing would be cleaning, having like a clean environment. So this is like wiping down everything, like making sure floors are clean, because little kids crawl all over the floors, tables, anything that they're going to come in contact with, making sure that's very clean and sterilized, because kids stick stuff in their mouths. And then the last thing would be vaccines. All of the three diseases that we talked about today can all be prevented with a vaccine. Measles has an MMR vaccine, which is measles, mumps, and rubella. Pertussis has a vaccine, and then so does the varicella zoster. That's the chickenpox vaccine too. So all of these things you can use to help prevent and protect these children from getting all of these types of different diseases. So that's it today for our series on the pediatric safety. Hope you enjoy it, and please come back for next week's video. Bye!